The equipment required for an IV cannulation includes an alcohol swab, an op-site dressing, 3 pieces of adhesive tape at the appropriate length of approximately 10 centimetres, a 3-way tap, cannula, 10 ml normal saline as a flush, and a 10 ml syringe. I draw up the 10 ml of normal saline with a 10 ml syringe. I slightly remove the normal saline container from the tip of the syringe to reduce the pressure and then reconnect it, maintaining sterility of the syringe tip. I then proceed to flush the 3-way tap, ensuring that there are no blockages or kinks. I then turn the tap to the closed position. I remove the cannula from its packaging and ensure that all other equipment required during the cannulation is easily accessible. This involves removing the op-site dressing from its package and having the cap of the 3-way tap loosened. The tourniquet then gets applied to the patient's upper arm, restricting venous return and allowing for the identification of a plump vein for the cannulation. A radial pulse should then be taken to ensure that the tourniquet has not been applied too tightly. Wipe the selected site with an alcohol swab and place the swab above the sterilised section. A circular motion assists with the rapid drying of the alcohol swab. Align the cannula at a 20-degree angle with the bevel facing upwards. When removing the cap of the cannula, you need to verbalize sharps out. Proceed to insert the needle until a pop sensation is felt. This indicates the needle has entered the vein. There should be flashback in the hub of the cannula. Lower the needle and proceed approximately 5 millimeters. Then slide the cannula over the needle into the vein and release the tourniquet. Compress the vein by applying pressure with fingers over the cannula. Remove the needle and immediately discard into the sharps container, saying sharps away. Attach the 3-way tap and cover with the op-site. Tape the cannula appropriately with one piece under the end of the cannula and looping over, with another piece directly over the connection of the tap to the cannula, and one securing the tap in an appropriate position. The tap then needs to be put into the open position and a flush of normal saline of approximately 5 millimeters.